Hesi A2 Grammar 2025. Question 1. Which sentence demonstrates correct subject-verb agreement? The group of students are waiting for their results. The group of students is waiting for their results. The group of students were waiting for their results. The group of students have been waiting for their results. Group is a collective noun singular in form, so it takes a singular verb is. Options A, C, and D use plural verbs incorrectly. Question 2. In which option is the semicolon used correctly? The patient arrived late. However, the nurse still saw him. The patient arrived late, however, the nurse still saw him. The patient arrived late, however, the nurse still saw him. The patient arrived late, however, the nurse still saw him. A semicolon before, however, and a comma after it is correct. B, C, and D misplace the semicolon or omit necessary commas. Question 3. How would you correct this sentence? Each of the nurses have a different schedule. Each of the nurses has a different schedule. Each of the nurses are having a different schedule. Each of the nurses were a different schedule. Each of the nurses be having a different schedule. Each is singular, so it requires has. B uses plural, are, C uses past plural, were, D uses incorrect subjunctive be. Question 4. Choose the sentence with proper pronoun antecedent agreement. Every doctor must bring their own stethoscope. Every doctor must bring his or her own stethoscope. Every doctor must bring their own stethoscope. Every doctor must bring our own stethoscope. Every doctor is singular, so his or her agrees. Their A is increasingly accepted but less formal. C and D are grammatically wrong. Question 5. Which word best completes the sentence? The lab results were underscore than the previous ones. More worser. Worse. Worst. More bad. Worse is the correct comparative form of bad. More worser A is double comparative, worst C is superlative, more bad D is non-standard. Question 6. Identify the grammatically correct sentence. The patient laid on the bed for 2 hours. The patient lay on the bed for 2 hours. The patient lied on the bed for 2 hours. The patient lays on the bed for 2 hours. Lay, past tense of lie, meaning recline, is correct. Laid A requires an object, lied C means fibbed, lays D is present tense. Question 7. Which phrase replaces the underlined part correctly? Neither the nurse nor the assistant's available. Is, are, was, be. With neither slash nor, the verb agrees with the closer subject, assistants, plural, so are is correct. A and C are singular, D is incorrect form. Question 8. When should effect be used instead of effect? To indicate a result or outcome. To mean to influence as a verb. To mean a change resulting from an action. To describe a final consequence. Effect is usually a verb meaning to influence. A, C, and D describe the noun effect. Question 9. Which sentence uses the comma correctly? Before surgery, the patient signed the consent form. 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 A comma after an introductory phrase, before surgery, is correct. A, C, and D place commas incorrectly. Question 10. Rewrite correctly. The medication's side effects was mild. The medication's side effects were mild. The medication's side effects were mild. The medication's side effects was mild. The medication's side effects is mild. Subject, side effects is plural, so were is needed. Apostrophe in medications shows possession. A misses apostrophe, C has wrong apostrophe placement, D uses is incorrectly. Question 11. Which sentence is passive voice? The surgeon performed the operation. The operation was performed by the surgeon. The surgeon will perform the operation. The surgeon is performing the operation. Passive voice equals subject receives action. Operation was performed. A, C, D are active voice. Question 12. Choose the correct form of the two treatments. This one is underscore, 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 dot. The most effective. More effective. The more effective. Most effective. When comparing exactly two items, use the more effective. A and D are for three or more. B omits the. Question 13. Which option shows parallel structure? She enjoys reading, to write, and calculating dosages. She enjoys reading, writing, and calculating dosages. She enjoys to read, write, and calculating dosages. She enjoys reading, to write, and to calculate dosages. All items are gerunds, reading, writing, calculating. A mixes gerund / infinitive, C and D break parallelism. Question 14. Select the correctly punctuated sentence. The nurse's report said, vital signs are stable. 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 Nurses equals singular possessive. Quote starts with capital letter. A lacks apostrophe, C is plural possessive, wrong unless multiple nurses, D missing apostrophe. Question 15. Which word is the simple subject? The chart with the red flag needs immediate review. Chart, flag, review, needs. Simple subject is the main noun without modifiers. Chart. Flag is object of preposition, review is object, needs is verb. Question 16. Identify the sentence with a misplaced modifier. Walking to the ward, the clipboard fell. While walking to the ward, she dropped the clipboard. The clipboard fell as she walked to the ward. She dropped the clipboard walking to the ward. Walking to the ward seems to modify clipboard, clipboard wasn't walking. B, C, D correctly attach modifier to she. Question 17. Complete the sentence. If I underscore 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 the dosage earlier, the reaction might have been prevented. Knew, had known, have known, would know. Past perfect had known is correct for unreal past condition. Third conditional. A is simple past, C is present perfect, D is modal wrong tense. Question 18. Which conjunction best fits? The patient requested pain relief. Underscore 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 the doctor approved it. Yet, so, for, nor. So shows cause effect, request approval. Yet shows contrast for gives reason, nor introduces negative. Question 19. Choose the correct word. The nurse had to underscore 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 the medication due to an allergy. Withhold, 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 withhold. Withhold equals to hold back. A, C, D are misspellings. Question 20. Which sentence uses proper capitalization? She works in the emergency department at County General Hospital. She works in the emergency department at County General Hospital. She works in the emergency department at County General Hospital. She works in the emergency department at County General Hospital. Proper nouns emergency department and county general hospital are capitalized. B, C, D have incorrect lowercase.